ABG Study K, Steins, and Answers with Verified Solutions. A patient who has been on prolonged mechanical ventilation shows the following arterial blood gas results: pH 7.48, PaO2 85 millimeters of mercury, PaCO 232 millimeters of mercury, and HCO 325 milliequivalent/L. What does the nurse conclude about these results? Yes. A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. D. The nurse interprets these findings as indicating respiratory alkalosis due to the elevated pH and decreased PaCO2, suggesting a respiratory cause. Other options are incorrect based on these ABG values. A patient presents with the following arterial blood gas, ABG, results: pH 7.32, PaO2 88 millimeters, Hg, PaCO 237 millimeters of mercury, and HCO 316 milliequivalent/L. How does the nurse interpret these results as? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. 1/3. D. Respiratory alkalosis. A. The pH and HCO 3 levels indicate metabolic acidosis. These ABG results do not align with the other conditions listed. A 2-year-old child is brought to the emergency department after ingesting several morphine tablets from his mother's purse. Which acid-base imbalance does the nurse recognize as the child's greatest risk? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis heavy checkmark ANS. A. Morphine overdose can lead to respiratory depression and hypoventilation, resulting in CO2 retention and respiratory acidosis. A patient with a bowel obstruction has had a nasogastric tube set to low intermittent suction for the past 3 days, and their respiratory rate has decreased to 12 breaths per minute. What arterial blood gas values does the nurse expect for this patient? 2/3. A. pH 7.78, PaCO 240 millimeters of mercury, HCO 330 milliequivalent/L. B. pH 7.52, PaCO 248 millimeters of mercury, HCO 328 milliequivalent/L. C. pH 7.35, PaCO 235 millimeters of mercury, HCO 326 milliequivalent/L. D. pH 7.25, PaCO 247 millimeters of mercury, HCO 329 milliequivalent/L. Heavy checkmark ANS. B. The patient likely exhibits compensated metabolic alkalosis with an elevated pH and HCO3 levels alongside slightly acidic CO2 levels indicative of compensatory respiratory acidosis. Which acid-base imbalance is least likely to show full compensation? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis heavy checkmark ANS. B. Full compensation is unlikely for respiratory alkalosis, typically caused by temporary conditions like asthma attacks. When evaluating uncompensated respiratory alkalosis, which laboratory value should the nurse primarily examine? Powered by TCPDF, www.tcpdf.org. 3/3.